Welcome to the second in our series of webinars developed for people with newly diagnosed celiac disease. This session will look at the process for diagnosing celiac disease. Taking you through this series will be our presenter Leah Seamark, who is a specialist gastroenterology dietitian working for Somerset Partnership NHS Foundation Trust. She'll be joined by a panel of NHS specialists who will be asked various questions throughout the series. For those of you who'd listened to the session 1, you'll have heard Dr. Emma Gregg briefly mention some of the procedures undertaken to diagnose celiac disease. I will now hand you over to Leah, who will explain the overall process.
Those of you who are watching today who have had that diagnosis, you've been through this procedure, so often it starts off with going to see your GP with some symptom, and it could be one or many of the ones that we've just mentioned, and the GP may look at sort of your personal and family history and do a general assessment of the symptoms. If they are considering whether celiac disease may be a cause of that, they'll then do a blood test. And the blood test they're looking at is something called an immunoglobulin A tissue transglutinase, shortened to IgA-TTG. And this is an antibody specific to celiac disease. So people with celiac disease, when they're eating gluten, this IgA-TTG will be raised higher than normal levels. So if you have that blood test and it comes back positive, you should then be referred on to the gastroenterologist, where they may start to consider a gut biopsy.
2 or 3 different ways of having the procedure done these days. It's usually done via the mouth. We can either spray the back of the throat to make it numb, to make it easy for you to swallow the endoscope, which is a little thin tube about as thick as your little finger. Or alternatively, you can have a sedative which makes you feel woozy but won't put you to sleep. We'd aim to undertake the endoscopy, which is a quick procedure which takes less than 5 minutes, aiming to pass the scope down in through your mouth, through your gullet, through your stomach, and into the first part of the small bowel just to take some biopsies. It's over very quickly within 5 minutes. We can send the tissue off to the lab. You would then be able to, your swallowing would come back to normal if you've had throat spray. The sedation wears off fairly quickly, and you'll then be able to go about your normal day. The one thing I would say is it's really important that you eat gluten for the 2 weeks before an endoscopy. And the reason for that is we don't want to get a falsely negative reading. If you've already started a gluten-free diet, then the lining will have started to change back towards normal, and it may be that we don't capture the changes. The only other comment I would make is if you are concerned about a tube going into the mouth, we do have the facility to undertake a procedure which involves a smaller camera, again passing through the nose, which reduces the chance of you having a problem with scope making you gag. And it may be that you want to think about that, and you can talk to your doctor about that, because there is a way of doing that. So if you have concerns, talk to your doctor before the referral.
And I'm right in thinking that that kind of procedure is really to look at the extent of damage to the lining of that gut.
That could be done in the pathology lab when we have the sample.
And as Emma has already mentioned, it is essential that throughout that whole process that you eat gluten daily until after the biopsy, to enable for us to get a true representation of what your response is to gluten.
So I've got a question for our consultants. I've had a positive blood test and feel certain I have celiac disease due to my family history. Can't I just start the gluten-free diet and start to feel better? Do I really need to have the biopsy?
A gluten-free diet is quite an undertaking, and it's a lifelong undertaking, so it's very important to be absolutely certain that the diagnosis is correct. And it is possible to have a false positive blood test where the TTG antibodies come up positive, but in fact you haven't got celiac disease. So I think you want to be 100% sure and confirm that with a biopsy.
I've got another question. I've recently been diagnosed with celiac disease. Will my kids get it? And should my family members get tested too?
As Leah has already said, the risk to a first-degree relative having celiac disease is about 1 in 10 or 10%. So it is definitely worth thinking about getting tested if you're having symptoms or any of your first-degree family members are having symptoms. So that's your mother, father, brother, sister, any children. There is some question about whether people should be tested even if they haven't got any symptoms. But again, it's something to talk about with your GP.
So it's fair to say that if you have first-degree relative with it and you have symptoms, definitely go and get them tested. Brilliant, thank you.
I have another question. Following a biopsy, I've been told I have celiac disease. However, the biopsy showed I just have mild damage to my gut. Does that mean I don't need to be as strict with my gluten-free diet?
Unfortunately not. It's very important to be very strict with the diet, and in this case, no, they shouldn't have a trace of gluten in their diet. There's still the risk that they will malabsorb nutrients from their diet. So no, you have to be very strict.
So if you've had the diagnosis of celiac disease, regardless of the extent of the damage to the gut lining, they still need to be 100% strict with that gluten-free diet.
Yes.
Yeah.
I have another question. Will I need to have another endoscopy and biopsy?
Now, just occasionally practice here is a little bit different around the country, but I think, Jim, you'd agree with me that we hold the view that if someone's well after they go onto a gluten-free diet, their bloods have gone back to normal and they're not having any symptoms, then we really wouldn't want to go ahead and repeat an endoscopy.
But we wouldn't repeat the biopsy routinely.
So on what instances would you maybe repeat the biopsy? Is it purely if they're still having symptoms later on down the line?
We would certainly do that. So if, say, at 3, 4, 5 months, they're still having problems, particularly if there's signs that they're still anemic, their antibody level isn't coming down on blood tests, because you'd expect those things to be going back to normal by then we might think about whether they've got refractory disease, which is a very tiny percentage of people with celiac disease, but sometimes we need to think about more than just a gluten-free diet. However, it's only worth doing if that is the case.
I'd agree. If people and they're not sure, there may be questions that a biopsy could answer, but it wouldn't be necessary if the blood tests are looking fine and the patient has responded well symptomatically.
So if symptoms are improving and the blood tests are improving, there's no need to do that repeat endoscopy.
I have one more question for our dietitian. How much gluten should I be having before the blood test and the gut biopsy?
There's no real hard and fast rule with an absolute specific amount, but it is a question that we get asked quite a lot. And we tend to say that at least in more than one meal a day for sort of 6 weeks prior to the blood test would be sufficient. So if you're thinking about a gluten-containing cereal, a slice of toast in the morning, maybe some breaded fish or chicken in the evening, that kind of thing. But yeah, more than one meal a day.
Okay, so it's having something containing gluten at 1 meal, 2 meals, or 1 meal and a snack every day for sort of up to 6 weeks up to that towards that blood test.
Yeah, absolutely.
Thank you to our specialist team for your answers, and thank you to you for watching our webinar. Remember, we have a series of webinars developed for people with newly diagnosed celiac disease, and you may wish to watch the next one in the series, which briefly discusses the complications associated with undiagnosed and untreated celiac disease.